Good afternoon and welcome to the April 20th, 2021 Lone Tree City Council study session. You may notice that things look a little bit differently. If you're in this room, you certainly notice things look a little differently. We are adjusting our practices to comply with the recently released Public Health Order 20-38, which eliminates social distancing requirements and capacity limitations in most venues to include this meeting. For the time being, we are still conducting a hybrid meeting to accommodate those who prefer to attend remotely. State Executive Order 2021-079 directs all Coloradans to wear non-medical face coverings in specific indoor public places when 10 or more unvaccinated individuals or individuals of unknown vaccination status gather. Given that the City Council and City staff have overwhelmingly opted to get vaccinated, we are under the 10-person threshold and we will not be wearing face coverings. Anyone is welcome to wear a face covering if they choose to do so. There is no public comment at our study sessions. Council does not vote during study sessions. Our presentations are for information and discussion only. We will obviously have public comment at our council meeting, which we will begin at 7 o'clock this evening. So we are excited to welcome some guests to start off our study session today. We have Laura Thomas, our Douglas County Commissioner, joined by Maggie Cooper, Special Project Manager and Community Response Team Coordinator, and Laura Ciccone from Douglas County Mental Health Initiative Coordinator. They are going to be providing an overview of Douglas County Mental Health Initiative and a collaboration with our police department as well. So we're very excited to welcome them. I'd invite our commissioner to come to the podium if she's going to kick it off, or if the chief, are you kicking it off?
It's good, you're fine.
Okay, I was like, my notes don't include you, sir, only the commissioner.
Good evening, Madam Chair, Madam Mayor, and all the council people, the chief, and everyone else here in the room. My name is Laura Thomas. I currently serve as a county commissioner, but from 2011 to 2015, I served as the Douglas County coroner. In January of 2014, I responded to a murder-suicide. There was a young male named Robert who we knew had mental illness problems. His mother and dad had come to Colorado from Eastern Europe. They had 2 boys and 2 girls, and after they got here, the father took his life. So the mother, Tatiana, was raising these 4 children by herself, and her youngest, Robert, had known mental health issues. She had been working with the county, and we were trying to get him, Robert, connected with services, but he fell through the cracks. That night, Tatiana was trying to get Robert to take his medication. He got angry, he found his mother's gun, he started chasing her through the house. He killed his mother, he chased his sisters up the stairs. One of his sisters went out the window, she broke her back and she's now paralyzed. The other sister was under the bed on a cell phone talking to the sheriff's department. She survived. Robert then went downstairs where his mother was and took his own life. After that happened, Douglas County said no more. We need to fix this gap and fix this problem. In May of 2017, we launched the first community response team. These community response teams are part of the Douglas County Mental Health Initiative. And these community response teams consist of a specially trained law enforcement officer and a mental clinician. And these ride in a patrol car. I've ridden with them. It is amazing work they do. They respond to calls that have a mental health crisis underlying what's going on. And to date, nobody has gone to jail from one of these situations. And the only people who go to jail are people who are going to be involved in an M1 hold. Other than that, nobody has gone to an emergency room. Most people are treated in place. I rode with the team when we transported a young man who had attempted suicide to an inpatient facility. And he was kept overnight, and we hope that that helped save his life. Let me just tell you about suicides. We keep hearing how suicides are going up and up. When I was the coroner, they were going up. From 2018 to 2019 in Douglas County, we saw a reduction in the number of suicides. And from 2019 to 2020, we saw another reduction in suicides. I believe it is the community response teams. There are currently 3 community response teams in place, and a special community response team that is for youth only. They respond to schools, and so they work with kids in schools who are struggling, with the school and the parents. We have a partnership agreement with you, and you are using the services of our community response teams. And I hope that after you hear this proposal and you start getting some stimulus money, it might be something that you could consider using this money for, because then you can get in a rotation with us and we'll have more coverage for the whole county. So far, we have saved $4.3 million, we believe, in cost to society through the hospitals and the jails through these programs. We can't even begin to count the number of lives that have been saved. In 2020, there were 1,279 individuals, unique individuals, who were treated by the community response teams. So when they go to a scene, they are able to let the police officers on the scene clear, which the chief probably really likes, because then he's got more cars on the street to respond. The basis of all this is partnerships. We have over 40 different groups that are working together. And we are here to ask you to consider being one of our partners, so thank you. Laura?
Thank you, Commissioner, for the introduction. Greetings, everyone. Thank you so much for having us this evening. My name is Laura. I coordinate the Douglas County Mental Health Initiative, and I'm here to just add some context for all of you about who we are and what we do. If we could hit the next slide and onto our vision statement, please. So Commissioner Thomas already did an excellent job of describing why the Mental Health Initiative was established in 2014. So I will just draw attention to our vision statement, which our 40+ organizational partners developed together. It highlights the importance of action, addressing unmet mental health needs, connecting people to mental health services, preventing those in need from falling through the cracks, and making sure that our behavioral health system has services from the base, community base, all the way up through crisis and acute care. Next slide, please. So we're addressing quite a bit in the Mental Health Initiative. One significant barrier to accessing care in Colorado's behavioral health system is that it is siloed, meaning that funding, services, waivers are all managed by different departments that don't always efficiently communicate with one another. Therefore, it's difficult for the average consumer to navigate and actually link to services that they need. Siloed systems also can duplicate services, which inefficiently utilizes finite resources. And we don't necessarily have all of the services that we need in Douglas County yet to serve all people at all levels of need. Although since the Mental Health Initiative was established, we have welcomed additional services that we did not have before. So through our various strategies, we are addressing these siloed systems. We're addressing stigma, which is a barrier to accessing care, enhanced care coordination through our Care Compact, crisis for mental health and substance use disorder through the CRT, and specialized programs for youth with our youth CRT and the toolkit. Next slide, please. So these are our partners by sector. We certainly rely on every individual in the initiative to make sure that we can advance our strategies. It's really not possible for any single government entity to do this alone. We can't do it in a vacuum. And I'm really proud to say that most of these partners have been present at the table since the initiative was established in 2014. Next slide, please. So after about a year of running the CRT program, the county issued an RFP and contracted with Health Management Associates. This is a national firm, but they have an office in Denver, and they've actually been contracted with the state to help with behavioral health reform at the state level. And we asked them to help us in Douglas County develop a community-based mental health delivery system. Leading up to this point, we had learned a lot through our CRT program about the ways in which the crisis and care system functioned, and also where it failed. And we realized that in order for the CRT to be the most successful program that it could be, that the system had to be responsive. It had to support the program, and it had to support the people that the program was serving. So we decided to take a step back, take a look at the system, and we found we needed a stronger, more networked system that really ran the gamut from general population well-being to mild to moderate mental health services, all the way up to crisis. Next slide, please. With the launch of the blueprint in 2019, we changed our governance structure to accommodate that strategy and make sure that we could get the work done. So we're guided by our common vision. Our large mental health initiative meets on a quarterly basis. The steering committee, which is made up of decision makers and leaders from each of our core partners, along with the county, guides the strategy of the initiative. And we have 4 active work groups, one of which is the community response team. The other 3 are named for the priority areas outlined in the blueprint. So that's creating a network system of care, rebranding mental health and substance use, which is your anti-stigma community education space, and developing programs and interventions to address gaps. And Douglas County staff acts as the backbone. So that's me, Maggie, Deputy County Manager, and one other staff member who leads the Care Compact program, which I'll talk about in a little bit. And this year, we are also welcoming members of the Douglas Arapahoe Suicide Prevention Alliance. They'll be joining forces with us. So we'll be adding a suicide prevention work group as well. Next slide. We have adopted a formal collective impact approach for the mental health initiative. This is a model that helps large initiatives like the Douglas County Mental Health Initiative achieve measurable change. And it's a really high level of accountability in the initiative. We do expect members of the initiative to be present, to be active, to be accomplishing homework, action items. That's how we get things done, and that's how we stay action oriented. Next slide, please. So along with the text of the blueprint that the Mental Health Initiative developed with Health Management Associates, we asked for a model to visualize what the system could look like. So this is our stepped model of care. This is a county-based model intended to support education and resources for the general population, improve the health of individuals with mild to moderate mental health issues, as well as connect and convene intensive wraparound services for those with significant and complex mental health needs. The model addresses well-being of all age groups and recognizes that any person at any given time can move up and down this continuum, and that the system should be effective in responding to those needs. Next slide, please. So the next couple of slides are examples of these services and assets, but also some of the gaps that we have in Douglas County. These were developed by our partner organizations for each of those stepped model of care areas. So I won't go through this in detail, but for those who are interested in our assets, what folks in Douglas County have access to, but also where we have some work to do, I wanted you to have this. And I've outlined a couple of things along the side that Mental Health Initiative and our partner organizations have done. And I do want to extend a thank you to Mayor Millet, because I know you contributed to the Let's Talk Anti-Stigma campaign. You filmed a PSA along with the South Suburban Rec Board Chair. So just want to say thank you for supporting the work. Next slide, please. Primary care continuum. This is a really big area for us to tackle in Douglas County, and we've got some work to do here, but it's really important. A lot of people probably go to their primary care doctor. They might be one of the first people that they talk to about how they're feeling. So it's important that primary care docs are doing regular screenings, that they're aware of the resources that are available and can make those referrals when appropriate. And last, on the next slide, we have the specialty behavioral health continuum. This is really where the mental health initiative got its start, most notably with the CRT program. So we've had the most time to do some work here. That's why there's lots of arrows and lots of text. So these are, a couple of examples of the dents we've made, lots of work left to do. And at the very bottom, I will touch on the Care Compact in just a couple of minutes. And if I can wrap up with this next slide, for anyone interested in checking out the state of mental health in Douglas County, we've outlined a couple of resources. Many of you may already be familiar with these, but just in case you're not, these are live links. If you have access to the PowerPoint, you should be able to click these and read about mental health in the county anytime you like. With that, I'll turn it over to my colleague, Maggie Cooper. Thank you.
Thank you, Laura. Good afternoon. My name is Maggie Cooper. I'm the CRT coordinator for Douglas County, and I just want to say thank you again for having us here today. We have a short video that we'd like to show for you, and then I'll talk a little bit more about our program.
Douglas, beautiful. Fast growing county in the country for years.
911, what's the address?
Nobody calls 911 because they're having a good day.
My brother's in the and he took a bunch of food and
Mental health is an issue plaguing communities across the United States, and Douglas County is not immune to that.
A patient of mine had talked to me this morning and she was suicidal.
Douglas County got together with their partners and started the conversation. How can we do this better?
We came together and we decided, in working with the police department, that they would have a law enforcement officer who would be specifically trained in this.
Think about things that are going to calm you down.
They would have a mental health person working with them.
I'm in distress and I'm asking for help.
We also recognize the need for having our partners in the fire service be a part of this project as well.
Well, we're going to get you some help because you shouldn't feel that angry, right?
It's not just about grabbing a police officer and a mental health clinician, a fire officer, and putting them in a car together or putting them on a team. It's really about choosing those people that desire to be involved in this, that care about people and care about people with mental health issues.
Handle this stuff right now, and then afterwards we can talk, okay? Yeah. Okay.
The community response team, the CRT, has done a lot to change what mental health care looks like in Douglas County.
Getting to them sort of before the crisis is actually amplified or escalated. That's key.
If it wasn't for you, I don't know what I would have done.
And there is help and there is hope.
To feel like you were actually finally part of the solution rather than just perpetuating the problem. And I think that's why everybody's very excited about this program.
They are getting the right help to these people at the right time when they're the most vulnerable.
Thank you.
Thank you. Next slide, please. So as Commissioner Thomas stated, the CRT program launched in May of 2017. We have three main goals. We want to avoid the emergency department for mental health crises unless medically necessary. We want to avoid taking people to jail when mental health is the primary issue. And we want to help people find resources for mental health and behavioral health support. Next slide, please. The CRT response is available throughout Douglas County. Today, we consist of 4 teams, 3 community teams, and 1 specialized youth team that receives referrals and responds to calls originating from Douglas County schools located within the pilot area. Each team is staffed with a full-time dedicated law enforcement officer and mental health clinician, and each team is assigned a full-time dedicated case manager to follow up once the crisis has passed. Our teams are staffed with officers from the Douglas County Sheriff's Office, Parker Police Department, and the Castle Rock Police Department. And the officers from Parker and Castle Rock have been deputized by the Douglas County Sheriff to allow them to respond anywhere within the county, allowing for coverage for other teams when they're not on staff or unavailable. Next slide, please. Once the CRT arrives on scene, the law enforcement will clear the scene for safety. When the scene has been deemed safe, the CRT clinician meets with the individual, completes necessary assessments, and works with the client to determine the next steps. If necessary, our AMS partners will respond and complete point of care testing, which allows our CRTs to bypass the emergency department and transport people directly to behavioral health care facilities. Other outcomes for these calls include treating the individual in place and providing them with resources, transporting them to a more supportive and safe environment in the moment, maybe a family or a friend's home, or placing them on an M1 hold, which is a 72-hour mental health hold. After the initial crisis has passed, one of our CRT case managers will reach out to the individual and help them locate appropriate and long-term sources of support and care for their behavioral health needs. Next slide, please. I'm proud to say that our data demonstrates significant progress as we work towards our goals. Between 2019 and 2020, we'll see an increase in individuals served, in successful encounters, and those referred for case management. We'll also see a decrease in the number of people placed on M1 holds or taken to jail or the emergency department. From the program's inception through the end of 2019, known cost avoidance is estimated to be $4.3 million. And by the end of 2021, the CRT program is on track to have saved over $5 million. Next slide, please. The success of our CRT program is made possible only by the support and dedication of our partners, which include Caring Communities of Colorado, our clinical health provider, Castle Rock Fire and Rescue, Castle Rock Police Department, the Douglas County Government, Douglas County School District, Douglas County Sheriff's Office, Lone Tree Police Department, who acts as a referring partner, Parker Police Department, and South Metro Fire and Rescue. Now I'd like to turn it back to Laura to discuss the next level of behavioral health support and the newest project of the Douglas County Mental Health Initiative, the CARE Compact.
I'm back. So the CARE Compact, as Maggie mentioned, is our newest program. As the CRT program was growing and running, we realized that especially for the most vulnerable residents in Douglas County, often who have co-occurring needs, meaning maybe mental health issues and substance use disorder, mental health and intellectual developmental disabilities, that receiving effective care long-term is really challenging. And the CRT wasn't necessarily equipped to serve these individuals long-term. So between the CRT and what our partners identified in the blueprint, we knew that what we call enhanced care coordination was really, really needed. This is also something at the state level that has been identified as a need. So through the CARE Compact, we are not creating a wholly new and distinct system of care. We are linking partners who already provide care coordination services through a streamlined network to serve these vulnerable individuals. And together they work as a unit to develop shared treatment plans, shared care plans, and address the goals on the screen. Next slide, please. So through the established mental health initiative, we were able to call upon our partners and create the CARE Compact relatively quickly. And as we have an eye to the future and are talking about expansion, we do look forward to adding additional partners to the CARE Compact. Next slide. The CARE Compact aims to limit and reduce interactions with the criminal justice system, crisis systems, and acute care systems, like cycling in and out of inpatient settings as much as possible. That's represented on the left side of the screen, in favor of a person-centered model that wraps an individual in care from multiple sectors who are all communicating and working together on person-centered goals. We, to make sure that this communication is happening, utilize a web-based system for case management. It allows all of our disparate partners to access shared information and collaborate on that system. It's HIPAA compliant, which means we can share healthcare information. It's 42 CFR Part 2 compliant, which means we can share substance use disorder information. And we are building it out to accommodate the Care Compact. The CRT program already utilizes GLOTA. It's also our reporting system for our programs. Next slide, please. And we have just hit the 4-month pilot mark. So we're in the formalized Care Compact section of this slide. Again, building out GLOTA, training our partners, working on agreements to get them on the system, speaking with our partners about capacity, and having an eye towards expansion. And this is a model that the state is interested in. We've talked to subcommittees of the Behavioral Health Task Force. As they're exploring regional care coordination as a part of behavioral health reform at the state, are really interested in local models. So they have their eye on the Care Compact. Next slide, please. So from about mid-December to early April, we received 14 referrals, 7 of which became active clients in the Care Compact. And you can see a breakdown of the types of needs that these individuals have. We have had 8 partner agencies actively involved in what we call Care Compact teams. So meeting, developing plans with the client, working towards achieving shared client goals. And we've completed 22 care coordination staffings. And one preliminary piece of data, we are working on our evaluation and hope to have more to share with the public soon, but we've seen a 91% reduction in individuals who had prior contact with the CRTs. We've seen a 91% reduction in their contact after referral to the Care Compact. So it's a great early stat for us. And with that, I think we are completing our presentation and happy to answer any questions that you might have. Thank you.
Well, thank you, Commissioner, and also to Maggie and to Laura for this. It's really been enlightening, and you did a great job, because as I wrote my questions down, one of you answered them in your next one. But before we open it up, I do want to give the chief an opportunity to comment, and I know you were, council had a lot of questions about how we could support folks in our community with mental health and mental health issues and resources. And the chief was kind enough to make us aware of what the great work that's happening already. So Chief.
Well, since the time I was here, I think one of the questions that came up was, how are we tracking? In fact, Laura and I actually talked about this on the phone.
That's Commissioner Thomas to you.
Talking Laura, to the other Laura.
All right.
Kristen Cone. But
you do metrics. You do metrics.
We have figured out a way to track that. So we're starting that tracking way now and through our CAD system, and essentially worked with Parker and figured out a way to flag cases even when we're not calling CRT, to start tracking mental health, transient contacts, and then substance abuse. So. But what I will tell you is that, one, I do think it's a great program. Again, we had one in Colorado Springs when I was there, and I've seen a lot of positive impact from that. And I will tell you, there's still need for more, to have more teams. We just had a call yesterday. I read a report yesterday where they wanted a CRT person for a very difficult situation with some woman that was having her kids taken away and had some substance abuse issues and some other issues. And there wasn't one available. We still obviously handled the call, but that happens. There's only so many things 3 teams can do on a 24/7 operation through a large county with a huge population, and we're not seeing any lack of mental health issues. Our officers, I would say, without having hard data, it's daily, 2 or 3 times a day that they're coming face to face with these mental health challenges, and whether that's a transient at the light rail or a shoplift or someone in one of our hotels or in someone in our houses, it's pretty much daily that we're having some type of issue like that. So with that, I just say thank you so much for being here. I appreciate it, and turn it over for questions if you have any for them.
Thanks, Chief.
Okay.
All right, Council, questions?
I have
yes.
A couple. I think you guys referenced about 4.3 million in cost avoidance, and this seems to be the right approach to, and even the best approach for addressing these types of situations. But I also suspect there might be some net savings as well. Do you have an idea of how much net savings after the cost of the program?
Well, we calculate cost savings by a few ways. We calculate the cost of an emergency room visit and how much that would cost the system and the individual themselves, the cost of fire EMS responding, the personnel on the unit, and all of those metrics are calculated, and that's how we arrive at our cost savings number. The overall operating budget for the CRT is just about $660,000. So I would say it's an investment well worth it. I don't have a number for net savings as you're asking, but we're definitely seeing the impact in the community and then the impact on the systems that we're saving these visits to.
That's great. I had one other question. Are there any circumstances that you've come across where the team was in jeopardy, where
safety,
it was right,
unsafe,
meaning so unsafe that it was not right for the team to be there, or does that not happen? I don't understand the problem well enough to know if that's a...
Absolutely. So if a scene appears to be too dangerous to involve a civilian, like a mental health clinician from entering, the law enforcement officer makes that determination either prior to arriving on scene and calling for backup, or assessing the scene when they arrive and making that determination at that point. If it is deemed too unsafe for our CRT to be the sole response, yes, we do receive support, and the CRT will hold off on intervening from the mental health perspective until it has been deemed safe enough.
Great, thank you.
Jay.
Yeah, no, I'm highly supportive of the CRT model, and I like the care compact aspect of it for the whole wraparound piece for sure. And then Laura and I've had a chance to interface with the Douglas County Youth Initiative on a few items, one being the toolkit, and just to keep you posted on where we are in our interaction with the kids is they don't really know where to go for resources, and so we're trying to find a creative way to market the toolkit, whether it be through TikTok or social media, Instagram, kind of where they spend their time. But I know the schools have been really instrumental in creating the awareness for it. So a couple weeks ago, Douglas County School District had Mental Health Week, and they rolled out a bunch of programs to the kids just to reinforce that there are all these great resources either in the school or outside of the school. So I'm glad to see all the progress being made. I know a lot of it came from your efforts, so thank you for all that.
Thank you.
Anything, Kathy?
No questions for me.
Mike?
I heard the number of 1,200 cases a year or so that you've had involvement in, and then the chief mentioned that maybe we need more teams. How would we go about characterizing the benefits of additional teams?
Certainly. As Commissioner Thomas pointed out, when a CRT arrives, it not only provides the appropriate response for that situation, but it allows patrol officers to return to patrolling. And so, resources are not wasted. The appropriate response for the appropriate call is able to be determined. Lone Tree makes plenty of referrals. We see quite a few referrals come in, and Lone Tree Police Department is also able to call for CRT assistance on an active 911 call if they feel that it would be helpful. Currently, Lone Tree is not a full partner in the program, and we would love to bring you all on as one. All of our partners have seen very impactful data returns for their own agencies, and we'd like to show Lone Tree those same advantages.
Anything else?
If I could just add one thing to that. I think one of the benefits that we'll see if we had our own CRT member, and one, we'd have a highly trained officer who's in that system is already working with all the other CRT members, has a better understanding of everything they just explained here today, which the average officer is not going to have any idea about this kind of approach. They've all been trained, most of them in CIT, but that's really just crisis intervention and trying to de-escalate things and then get them to the hospital or evaluate them whether they have an M1. With a CRT person, they can be an immediate resource for our officers. You know, they get to see them every day. They would help provide additional training to our officers, be able to answer questions, help coordinate. Like right now, our primary coordinator is Detective Jones. And well, she's a detective that handles cases is her primary job, and this is a secondary job in which she tries to handle the CIT referrals. She actually tries to follow up with folks who have been in crisis that live in the city. And so that would be, now we have this additional resource that can do those things, because a lot of what CRT does is not immediate. So they may know, you know, that Kirk Wilson was in crisis yesterday. Maybe they weren't available. Well, they're going to come out and follow up with me the next day, and maybe even follow additionally, like in weeks to come, to make sure I'm still on an even kill and I'm still getting the resources I need. And I'm not going to start recalling 911 as I had been doing previous to that, because that's what you see. You see this repetitive 911 usage. We end up taking people to the hospital over and over again on M1 holds, and it's just not an effective way to manage the issue. So for me, I think that's where you'll see the real benefit to the city, because we do have people that are in crisis that come here, either they're visiting or they live here. And this will allow another resource to really focus on trying to deal with those things so we can stop some of the recurrence and really the drain on the overall health system and police and fire.
Wynn, go ahead.
One follow-up question then. So for the people who are visiting through, you know, whatever means, what happens to them? Sometimes people like that are hard to find.
They do coordinate outside the county. So.
Certainly, it's a great question. When possible, we connect with if there's a community or a crisis team in the location that they're from. If they're known to be, you know, transient, but be mostly in Denver, and they get picked up at Target here from the light rail. If we receive a referral for that, we will outreach to our colleagues in Denver. And if possible, we always try to connect with someone who can help support them in their most typical residence.
Great, thank you.
So I do have a couple questions also. I think Jay raised some good issues or points regarding awareness for kids, but I actually think there's a lack of awareness for adults. And the first thing they do is pick up the phone potentially and call 911 because they don't know who else or how else to get the services they need. Is there an initiative as part of the, and I want to make sure I get my names correctly, the Douglas County Mental Health Initiative, kind of trying to raise that level of awareness so adults recognize 911 may not be the best place to call, or is there another resource for folks?
Great observation. I would agree with you. Mental health is different than the physical healthcare system. We've all grown up knowing who to go to if we have a physical healthcare issue, mental health not so much, substance use not so much. So it tends to be emergency department, you know, it gets so bad that we go to the ED or we call 911. So the toolkit that Councilmember Carpenter mentioned, we're piloting with youth. We have built it out for adults. So we just wanted to make sure that it was hitting where it's supposed to hit first. And we have an intention, if all goes well, to build that out for adults. However, I would say under the rebranding mental health and substance use work group that is a part of the initiative, there is work to be done. I would say that it fits there. Part of that group is community education. We've mostly focused on anti-stigma to start, but community education, general awareness of resources, but also what is a mental health need? When do I need to get help? What contributes to good mental health? What might be, you know, a risk factor to my mental health? That's all a part of that community education piece. So recognized, still have to build some work around it.
And so this may kind of lead up to my other question, is that the pilot results looked great. I recognize it was a very small, but a 91% reduction in. So one of the hats I wore, particularly when my kids were little, was volunteering at their schools, and we would have kiddos that would come into the nurse's office all the time, and they would be called the frequent flyers because they were the kids that maybe didn't like a particular subject or just were having a particularly difficult time, and they would be in the nurse's office a couple days a week. And then, so there's always something else there, right? There was always something else driving that. That child didn't have a stomach ache at 11 o'clock every Monday, Wednesday, Friday. There was, so I imagine the same holds true. So what are you learning? What do you anticipate learning from the pilot that's going to drive decision-making and future systems that then will be broadened, much like you're starting with kids for the awareness piece of it? How do you anticipate broadening those services? And then I'll just give you a clue. The last question I have is, have you identified how many CR teams you would ideally like to see in Douglas County, and what's the right number there, and a cost? So there's that.
Yeah, I'll start and then I'll pass it to Maggie. One thing that we've learned in terms of where we might need to broaden, we don't have any inpatient psychiatric hospitals at the table, but we know from partnering with them under CRT and how many clients they take to the hospitals, and they discharge. Is there a plan? Is there not? Right. How can we connect them, wrap them around? That is a really important intervention point. And I'll just give an example. There's a man in the Care Compact who's been in and out of inpatient facilities 3 times in the last 2 weeks. And each time, it's really about system reaction. Like, can we get there fast enough? Do we know when they're discharging? Is there anything on the other end? So we have to be better and not so reactive. So we're kind of learning, when someone is hospitalized, we have to get together and start planning immediately, reaching out to our colleagues in the region, developing a plan. So I definitely think inpatient hospitals are the next level. Okay. But for CRT, I'll let Maggie take that.
Thanks.
So what CRT is learning about the need in the community is that youth still remains the most concerning population as far as mental and behavioral health goes. All of our partners have expressed interest in adding an additional team for the reasons that Chief Olson laid out. But our primary concern and our primary focus is adding a second youth team as soon as possible, so that way we are able to cover all schools in Douglas County. Ideally, we'd like to have currently the dream is about 5 community teams and 2 youth teams.
Okay. Great, thank you very much. I want to say a huge thank you to Douglas County for identifying this as an issue and then bringing everyone to act together in collaboration to address it. I think without Douglas County spearheading this, we would not, as a municipality, particularly our size, have the ability to really tackle this. And very much, Commissioner Thomas, if you could extend our gratitude to your fellow commissioners. This is a game changer, and Douglas County has a reputation of doing things right, and this is one thing I wholeheartedly believe you're doing right. So thank you for that really good work. And thank you for being here this evening with us. The chief and council is very interested in participating. We just have had a very, very challenging year with our budget, and we were down 30% basically in our revenue stream, but it is something that we have identified, and the chief has certainly made the case for that it's a game changer, and we recognize the importance of it. And if we've learned anything in 2020, we have learned the importance of our physical and mental and economic health. And they all 3 have to work together, and this piece has been lacking. So thank you all for coming this evening and this afternoon, sharing your wisdom and your vision with us. We very much appreciate it.
Thank you, Mayor. If I could just add,
absolutely.
We've been successful in Douglas County because of partnerships, and you all have partnered with us in many, many different ways. This is just another way we all work together to make Douglas County the best county in the state. So thank you, Mayor, council members, chief, and other guests here tonight. Thank you.
Thank you. Thank you so much for your time. Thanks. We very much appreciate it. Look forward to continuing to dialogue on this. So thank you. Okay, next. That was the most interesting one. So let's get back to basics now. No, actually we have a really interesting thing. It's our Youth Commission update, and we always learn from our youth commissioners. So we've got Laura Polito, and is she on the line?
Yes, she is.
Wonderful, thank you. Good evening, Laura. How are you? We hope you're well. We can't wait to hear what's going on with the Youth Commission.
Thank you. Yeah, good evening to the City Council and all present. If I haven't had the opportunity to get to know you yet, my name is Laura Polita, and I serve on the City of Lone Tree Youth Commission, and I'm also a volunteer for Lone Tree Teen Court. Today, I'm here to present an update on the work the Youth Commission is doing. As of our last meeting, we have raised more than $3,000 and have been spending them for the most part on $25 gift cards for schools in our community with families in need. To distribute, currently we are working on sending our thank you cards for all donations. Because of the work we've been doing, we've even been invited to the Acres Green end of the year picnic.
Oh.
In addition, we are partnering with Cornelius for a restaurant night on April 26th from 4 to 9 p.m., where 20% of all proceeds will be going to fundraising. This, along with a sign up for public volunteers, will help bring more awareness to the project. Recently, we also spoke with Curtis Hancock, coordinator for the Douglas County Youth Coalition, about the Youth Commission working with them on various opportunities, including writing articles about our work for the tobacco ordinance and the Lone Tree Give Entry project. Lastly, the Outstanding Youth of Lone Tree Award has opened and any applications are due by April 30th. That's all I have. Thank you for your time and attention. Are there any questions or comments?
Thanks, Laura. I'll check with council. Any thoughts from council?
Oh, great job, Laura, as always. Speaking of the Outstanding Youth of Lone Tree, the Outstanding Youth of Douglas County will actually be a virtual event on the 26th, so next Monday night. And I'll work with Liana. I'll get that to Liana and Austin to invite you all as well, just to attend. It's a pretty inspirational event for sure. But you kind of broke up a little bit when you said the Cornelius night. What's the date of the Cornelius promotion?
Yes, that's going to be on April 26th from 4 to 9 p.m.
Okay, perfect.
Same night.
4 to 9 though. Okay, perfect. 4 to 9. Excellent. Great. Thanks, Laura.
Okay, anything else? Well, Laura, you guys have been busy. A lot going on. I actually had a phone call from our local Lone Tree Voice, I think it was on Friday, and I was singing the praises of the Lone Tree Youth Commission and your great work on the ordinance dealing with tobacco and age of possession. And you guys really have stepped up, I think, in a very challenging year to accomplish a lot. So you're busy and we appreciate it. And we can't wait to see who you bring forward as the Outstanding Youth of Lone Tree. My personal favorite is every single one of you serving on the commission. But you're disqualified. So we'll have to wait to honor you in a different way. But thanks for being with us tonight and thanks for the update. We appreciate it.
Yes. Thank you so much.
Okay. We'll see you in person one of these days. All right. Thank you. All right, next on our agenda. All right, Justin, try following all the fun stuff, but this is meat and potatoes of city business. This is good stuff we're doing. Lincoln Avenue Concrete and Overlay Project timeline and our communications update. And this is, this is a project delayed, is a project anticipated, and a project we can't wait for. So tell us more.
All right. Well, good afternoon, Mayor and members of City Council. I'll do my best to follow those two acts, but give me a little challenging there. But you are correct. I'm excited, though, to bring our Lincoln Avenue Concrete and Overlay Project discussion to Council tonight. A year ago, we were having a whole lot of different conversations, so I'm really excited to be able to talk about some exciting construction projects that Public Works will have out there this year. The focus of this presentation is really going to be on the communication, some of the timing, and some of the phasing, really what our community is going to see. If you have any questions about details or numbers or those kind of things, we briefed before, but this is really about what our community is going to see coming up on this project very shortly. So next slide. So a quick background, Chavez Construction was awarded both of our 2021 concrete repair and asphalt overlay projects. We bid them separately, and in this case, the same contractor got both contracts. It actually does provide us a bit of a benefit in this case because it's pretty easy to have two contractors coordinate when it's the same contractor. So we have really been working with Chavez on their scheduling and really thinking through how we're going to do both these projects to minimize the impact on the community. To that note, staff held a pre-construction meeting with Chavez Construction on Wednesday, April 14th to discuss timing, communication, outreach for this project. It was a really good meeting. And additionally, one other thing, staff has been working with several utility companies to install all their projects prior to the start of construction and the roadway moratorium that will come, right? Once we complete a project of this scale and make the road really nice, we want to avoid anybody cutting into it for as long as possible. We do have a 2-year moratorium that we can apply on these roads. So you may have seen some work recently out there. That was Zayo doing some different work. Excel was out there doing some additional work recently. So we're working with all these companies to get done as quick as we can, get out of the way so that when we start doing the work, we have a clean slate to work from. Next slide. So talking about project communications, step 1 is tonight, briefing council on this project. Step 2, tomorrow, we are looking to get some of this communication be sent out to our HOAs and metro districts to really announce the start of our project, as well as the initial time frame, and provide, the website information that they can continue to get updates throughout the next several months of this project. We are going to be going a little above and beyond on this project and providing weekly updates to the HOAs and the metro districts. This is something we've done on a few other projects. You may remember when we did the crosswalk replacements in Ridgegate. We had a lot of impact, and so we did kind of a weekly update, right? Next week, you're going to see this, next week, this. So for some of our most impactful projects, we will go ahead and go to that level, and this certainly qualifies for that.
Hey, I'm going to just stop you for one quick second. What about the businesses? We have a lot. Did I jump ahead?
You jumped ahead.
All right,
yes.
then wait. Tell me then.
You're perfect. We'll be sending out additional communications as well on our city's website, social media, and Timberlines. This is to get out to the commuters, right? The bigger public, really the larger community that will be traveling through that may not get this indirect HOA. And then the last point, most of our businesses, we will be communicating with each of these businesses along the corridor, really on timing as a general, but we'll also be working with them because we are going to be doing some of this work that will impact access to their businesses. Typically in our history working, that's what they care. Their biggest concern is what is going to happen at my access or my location. And we'll be working individually with each one of those business owners as impacts are identified. Some will have very minimal impact, maybe just paving going through. Others will have concrete pans, right, being replaced in front of their property that will take a day or two. So it's going to vary much on how much communication we're doing with each individual business. But that is something the contractor has on their agenda, as well as Eric Barnes, our inspector, who does this for all of our projects and is well known by these business owners. He'll be reaching out and communicating as we get really closer to the impacts that you will see. So it's kind of trying to hit it in multiple avenues and multiple ways that we have communication out there with our community. And it's something we're going to have to continue to monitor and continue to maybe tweak as we go. But we did want to put out sort of too much information potentially, and then, make sure everyone's clearly aware of what we're working on. Next slide.
So the only thing I would just add, Justin, is I do feel like the businesses should receive that overall, the businesses on Lincoln should get the overall communication that's going to the HOAs, that what you're sending out on April 21st should also be going to the businesses, and with follow-up if there's a specific direct impact to access on them. Because unfortunately, or fortunately, they're pretty engaged. I got stopped at Safeway by by a gentleman who worked there who wanted to talk to me about traffic light and access. And I was like, okay, sir, we need to make sure you're kept in the know on this too. So I think it would be helpful.
We can certainly make sure we get that out there too, and work with our wonderful economic director to coordinate with all these business communications.
Yeah. I think we should. So thank you for letting me interrupt. Go ahead now. On to the work.
Yeah. Question, Justin. To expand on it just a little bit, just not necessarily the ones that face Lincoln. I mean, we have facilities like the Lone Tree Hotel that are planning events all summer long. And to the extent that they have advanced information, they can be talking to their clients about awareness that there'll be some traffic issues on Lincoln. And I think that's important for people they're trying to schedule long-term events over the course of the project.
Yeah, and all of those businesses behind the vet center, off of Rosemont, I mean, all of that,
And the apartments?
Yeah, but there's nothing, in the apartments too, nothing wrong with over communicating plans. And since we're already interrupted your flow.
Yeah, no, good, this is great, this is perfect.
Can we, are you aware of any additional contractors you're going to be working in the city roads between now and the start of this construction?
We are not aware of any additional work that would happen out there beyond what you see currently wrapping up.
Okay. I'd love to just put message boards. This is not the city. No. This is someone else, but go ahead.
Yeah, but we are, the last one is really Zayo completing some of their last work out there and some of the repair work they need to do for that, as well as some of the landscaping that they have, potentially damaged.
Yeah.
And getting rid of all the marks, utility marks. So that's the kind of work that will happen over the next week or two.
Okay.
But we're not aware of any other permits in, and if they get in now, they're, pretty much too late unless it was some type of emergency. Obviously we'd have to have that. And I think that's exactly, kind of identifying a few of those additional businesses here, and some that's a great point. Trying to make sure we are going to communicate that, but anything we can do to add that extra layer, that is helpful.
Yeah.
And Wynn, you had a question too?
Apartments, making sure we put notification for the apartments too.
And we'll talk a little bit about that in some of the apartments here in a minute too. And we'll talk about how there's a little bit of, throughout this project, there's a little different communication, right, for each of those uses that we're going to be talking about. So what I want to highlight here is this project is built to be done in phases. So you can see on this map, there's really a 3 phases that we are doing this work in and how we bid it out. So you can see phase 1 is the blue area that is closest to I-25. Phase 2 is really the middle section, kind of through Yosemite. And then the green section here is the furthest to the west. And we'll talk about that. Really, the reason we did this, we wanted to try to contain some of the work into different sections of Lincoln to coordinate with the businesses, the apartments, all the other uses that are in that area, and kind of contain it, right? So everyone kind of understand where we'll be working and not jumping up and down all along Lincoln Avenue throughout. So that was really the goal. And our contractors are aware of that, and they're phasing in this same manner. So I'm going to show kind of what each phase is going to be, and then we'll move to the asphalt project. So starting with phase 1, next slide. So phase 1 of the concrete repair. Now again, concrete repair work is going in and really fixing damaged concrete, right? We are not replacing all the concrete along Lincoln Avenue, but we are going in there and identifying locations that need repair, ramps, improvements, some different damage that's in the roadway and some of the pans, those kind of things. Right now, the contractor plans to start that work on May 3rd. So that's not, about a week and a half from now. May 3rd, that will be the planned start date for that repair work. It is going to start at I-25 and really on the north side of the street. So you can imagine kind of up there near the Chili's, right, area, starting that area. It will then continue, you can see from May 3rd to May 7th, will continue along that north side, moving west until they get to the end of that phase 1. They will then move to the south side of the road and continue east. So you can it's going to be this similar pattern of construction throughout, and then they will be moving back. Obviously, there will be different impacts for that work. This is very typically minimal impactful to the public though. And the reason is it is really contained to single lane closures along this corridor, and they are restricted to be out there from 8:30 to 3:30. So our non-commute hours. If you've been out there in those timeframes, there's certainly traffic, there's some speeding going, but certainly we don't anticipate these lane closures having major impacts during that time frame. And this will allow that work to go in sections each day. They will do the work, patch it back, and open up those lanes at the end of the day. Next slide. So moving to phase 2, again, this is that middle section around Yosemite. Again, you're going to see that was about a week, right, that we talked about for phase 1. Phase 2 is currently looking about 2 weeks. There's a little more damage in that section that needs to be repaired. Again, the same pattern. We're going to start work on the north side at phase 1 border. It's going to move west, jump to the south side of the street, and continue back. These lane closures will be the same, 8:30 to 3:30, and rotate around. Again, it's a very similar time frame, but again, it's going to be a little longer. They'll be out there about 2 weeks to complete this work. Next slide. And now we're into phase 3, so we're wrapping up our concrete repair work, kind of the end of May into early June, with the same rotation pattern and the same lane closures. So with our public, we'll be communicating this out again individually with each phase as we're impacting that area, and then at the larger scale with the community about where they're going to see this work kind of flowing throughout the area. Any questions on sort of any of those 3 phases before we jump into the asphalt, which is going to be a little more complicated? Okay, next slide.
Not necessarily related to those phases, but just a quick question as I was thinking of volume. Do we know when Charles Schwab is coming back to in person? Does anyone know when they're?
I heard September from.
September, okay, perfect. Because they attribute to a lot of volume along.
Right.
So I didn't know, okay.
The other thing is, what are the plans for Memorial Day?
Yeah, good question. So, we believe in our contractor conversation, they're planning to take off Memorial Day weekend, sort of around that time frame. So while this show's kind of going over that, right, we would not be having work on Memorial Day on that Monday, right, a holiday.
What about that Friday? Because people lose their minds when they're trying to get on the road. That is a big travel day. And I do remember, Seth, I don't know if you do, me calling you going, who let people do work on the road on the Friday before the 3-day weekend? Or it might have been poor Steve that got the vote down.
Right.
But I do question the judgment on that, that perhaps maybe that's that. And I'm just asking the question.
Yeah, I think that is certainly something our contractor would be willing to work with us on. So we can relay
stop
that.
at noon, perhaps, on that day, maybe, or start earlier and stop at noon. And again, I'm not saying to do that. I'm just saying, think about it.
I believe their anticipation is to kind of not do a lot of work around that weekend, but we'll confirm that with them and we can kind of work through that.
Yeah, do it over by Jay's side of the neighborhood. I'm kidding. I'm not traveling anywhere. Okay.
Yeah, we're trying to balance getting it done, but I agree. That's good.
Yeah.
And I just had a thought, if maybe, I think my biggest problem when there are construction issues going on, sometimes they don't take down the signs and sometimes you don't know what's going on, but it might be helpful, one, after they take down the signs or even while they're doing the work, to have the little portable sign that says construction continues until 3:30 p.m. And then after 3:30 p.m. it says construction resumes at 8:30 a.m. or something, so that people kind of get that feeling of what's going on as they drive through, because they might not be residents, they might not be businesses, they could just be on their way to the highway from Highlands Ranch.
And we do have several of, variable message boards within our contract, and those are the kind of things we can use, right, to get out that type of message. So we can kind of work with our contractor to find a way to put a message out there that the commuters will understand. Because you're right, that is the only way to reach them typically, right, is either the news or to put something out they see when they drive by.
Great, thanks.
Great questions. Okay, next slide. So this map's going to look oddly familiar. This is our project phases for our asphalt overlay, and colors are the same. Honestly, we want to, again, create expectation in the public about where things are happening. It made the most sense to try to phase the work in a similar manner. Next slide. Now, again, when we're talking about the asphalt overlay, this work is going to require the road-to-mill and then the overlay of all the lanes of Lincoln Avenue, all the way from flow line to flow line, including all the turn lanes. There's some sections along this corridor that if you drive it, you've probably seen, that will require a little additional roadway reconstruction work. We'll talk about that in a second. So that's going to be a little more intensive process where we actually have to do a little additional work to the subgrade and some of the repair work before the road-to-mill and overlay can occur. Again, I just want to highlight, this will be something we will continue to provide weekly updates to all the HOAs, metro districts, all the businesses in the community and all the area as well, and making sure they kind of understand exactly what lanes we're going to be closing at what time. This works a little further out, again in June and July, but we want to start people thinking about it. And as we refine exactly what those closures are going to look like, we'll be sending out that information. I do want to highlight, unlike what we just talked about, some single lane closures, this type of asphalt overlay is going to require multi-lane closures along Lincoln Avenue. And it is also going to require some night work. And we'll talk about that in a second. But this is, we're paving 20 to 40 feet of road at once to make sure we get a great product, to make sure we have a product that's going to last. But that is going to require a bit of coordination and significant closures for periods of time. Next slide. So again, phase one, right now we anticipate starting around June 7th. Again, there's a lot of things that have to happen all the way through then, and weather has to help us out and some other things. But right now we are planning that. Step one would be there's some removal of concrete crosswalks along the corridor that have some serious maintenance issues, much like we did in the rest of Ridgegate. They'll be removing that first. That way they can put back asphalt as part of the road-to-mill and overlay project. So that'll be step one in early June. We will then move around June 14th into the regular road-to-mill and overlay of phase one. Now, one thing to keep in mind is this section, the blue section that we looked at near I-25, is going to require the mass majority of that to be done at nighttime. And the reason for that is it will impact the ramps onto I-25. It will impact the interchange of I-25, and we do have to try to make sure we minimize that and do that work at night. This will require the biggest outreach, I think. I mean, there'll be a lot, but this is going to require significant outreach to be conducted to all the local businesses, the hotel that's at that area, the apartment buildings. And this is something we'll be working. We've done similar night work in the past and have worked with them, but this is going to take quite a bit of effort to make sure we do that. And the team's aware of this, and we'll be focusing on that as we get into that sort of 2-week time frame. Again, it won't all be all 2 weeks. It'll just be a day or two in there that'll be really impactful. And we're going to try to work with them to find when the best time to try to make that work happen is.
I'm getting flashbacks of phone calls from folks living in the apartments when some work was being done up at I-25 and
Correct.
Lincoln. So I do think that's really important. I don't know what we could do to help with it, but we can at least let them know it's coming. So I appreciate the thoughtful attention to that.
And that's what we heard a lot was, we want to know, and then we can communicate that out. And if somebody wants to go to a friend's house that night, they can, or whatever the case, or, they can work their schedule. That the information was what they understood with the reason typically, but they wanted more information about it. And then we're trying to make sure we meet that.
Yeah, and I would even argue during the day, folks are home working from their.
You see that more and more.
My husband and I were on Zoom when we found out our neighbors were having a little construction project going on, when we're like, what is that noise? So yeah, more communication, the better, I think, is the theme.
All right, move on to phase 2. So phase 2, this is, again, now we're further away from I-25. The plan here, we're back in a more residential area and the business area. And so this area will be done between 8:30 to 3:30, again, with the road to mill and overlay occurring during the day, during those off-peak hours. The one thing I wanted to highlight, you can see on the map here, this blue section is roughly where we have to go in and do the most amount of work of reconstruction. So, this is an area that will take a little bit more closure. We'll be working on the details of exactly how we're going to do this work with the contractor as we get closer. Again, this is planned for right now, early July. You can see this is after the 4th of July, right? We do want to make sure we create a big gap there around the 4th of July with all the festivities and also letting our contractor have a few days to celebrate. But you can see that is where this work will happen. There's some other work and patches, but this is the biggest section of significance that you will see. And I just want to make sure we highlighted that. Next slide. We've now moved into phase 3. We are getting into, the really nice warm months there at the end of July and early August. And again, this will be just a regular rotomill and overlay of phase 3. This area does have mostly just rotomill and overlay. Again, this section will be restricted to 8:30 to 3:30. This is one section, just the way we've watched traffic on Lincoln have our numbers. As you get further to the west, we do get more directional traffic a little bit. So what that means is, the morning it's kind of going one way, the afternoon a little more heavy. When we're by Schwab or the freeway, it's all the time, all directions. Right. So we may, when we get here, if we can get the project done a little quicker, we might try to extend that a little bit, right, based on the volumes. So for example, the inbound traffic, right, we could be working on the other side of the street a little longer. So this is something we'll be working on. The goal would be trying to minimize this. And the date I'm showing here of August 6th is kind of with some cushion, assuming weather, other things happen to us. We're really hopeful we can kind of accelerate all this, but I want to be fair that this could be where we end up, right, to make sure we get all this done into that early August timeframe. Next slide, I think that was it. So any questions or anything else we can kind of highlight today about this project? And again, we'll be continuing to provide more information over the next several weeks as we get into the project.
Thanks. Anything we didn't ask, guys?
Nothing for me.
No, just communicate, and then communicate, right?
Yeah.
All right, thank you, Justin. And you're not going anywhere, but thank you for that presentation. And I know council is busily scheduling their vacations to coordinate with their phases of the project. So, all right, update now, 1.4, update on our Safer Streets program.
Correct. So tonight I wanted to provide, this is going to be a brief update on really a project we have been working on with Dr. Cog and CDOT for their Safer Streets program. And so I'm going to go through just kind of a high level overview of it. And the reason is we are working on several IGAs with them right now that will be coming for your consideration in the next meeting or two. And I want to make sure we had a good understanding of the projects and what we're working on before you see the IGAs. So next slide. So quick background. Applications were submitted in the summer of 2020 for this project. Again, jurisdictions from all over the state of Colorado submitted for this. It was an incredibly competitive process. And eligible projects for the Safer Main Streets Initiative were selected through a committee review process that was conducted by CDOT, DRCOG, and RTD. So the three, big transportation agencies in the state all got together to really find a way, how can we make pedestrian, bike, transit projects and priorities without the metro region and really invest in some of these safety programs. And that is what everyone was excited to see. That was really an additional funding stream that came in, and there was a lot of excitement in the transportation geek world that I live in, but we were all excited about this. So there were 30 projects selected in round one. And again, that did include both applications from the city of Lone Tree. So we did apply for 2. We were selected in the first round for both of these. That took a bit of time. We were talking about really late 2020, early 2021, when this type of information was announced to the public. Next slide. Since then, the state has prepared, I think, a pretty impressive website that shows every project. So you can go onto the website right now at Safer Main Streets, and you can go through and look at every single project that was selected for funding, and everyone has a nice project sheet that looks like what you see on the screen here. So for the city of Lone Tree, this was our first project, our rapid rectangular flashing beacon project. You can see the goal is to install 6 of these throughout the city of Lone Tree at our highest priority pedestrian crossings. The amount funded, that is the amount that was awarded to us through DRCOG and CDOT, was $248,000. And you can see on the map here, really these are low cost, relatively, of course, but low cost ways to implement safety improvements at high use pedestrian crossings. And the Transportation Research Board has determined that really these systems are effective at increasing traffic yielding from 18% to 81%. Now, what that means is when you see the flashing, you stop more often, right? Than if you see someone just trying to cross into the street. There's been several of these developed around the metro area, including many I put in at my previous employer. So, we had a lot of safety benefits that we saw from installing this type of safety improvement, but they don't come cheap. You have to have wiring, you have to have infrastructure, you have to also upgrade the ramps and make sure those type of pedestrian treatments are there. That was really why we wanted to have the support of the state to really invest this. And again, we were lucky enough to get this grant. Next slide. I did want to highlight, so we have been working on our own City of Lone Tree flyer as well and project. What you're going to see is we have modified one location. And the main reason is we're doing a whole bunch of work at Acres Green and Parkway already. We got a signal, we're working on some other projects. So we were able to work with CDOT right now to relocate that to a bit of a higher priority location at the moment. And you'll see that is a little hard to see, but at the very bottom, number 4, right by the park. So we're working with Rampart Range Metro District right now, which will allow you to basically access the park and then walk along. And everything that you see in yellow, pretty much in the center, that is the Willow Creek Trail corridor. And all of our crossings are really focused along that. We see the highest use of pedestrian crossings really along the Willow Creek corridor for both recreation and travel. There's one other location, location 2, which is right by Monk and Mongoose at our other very high use pedestrian. We've done some recent improvements out there to put in bollards, some other pedestrian that's helped slow traffic a little bit and make it safer. This will just be the additional enhancement to that. And we've already been talking with the owners there, and they're very excited about seeing this improvement come and making it safer for their patrons and everyone else in the area. Any questions on that project? Again, it's a relatively simple project, but it's going to make a big difference. And it's something we're starting on design really soon, but CDOT wants to get these IGAs wrapped up as soon as we can.
So what's the nature of a flashing beacon? Is there one on each side of the road flashing in both directions?
Correct. Yep. So typically what they do is they will be on both sides of the road. On occasion, some of these are wider sections where we'll have one in the center of the road as well. You can think of Park Meadows Drive as you go from Yosemite right towards Quebec. There's a crossing there where the Willow Creek Trail, it's 4 lanes. We'll have an extra one in the middle of the road to make sure we can get that visibility in there. So each location has a little variance in how it looks, but they will all have at least 2 and sometimes one in the center of the road if it's possible. And they will face both directions with signage. Okay, next slide. So the other project, that was project 1. Project 2 is our C470 trail connector to the RTD/Park Meadows LRT light rail station. This project is really something that the county, as you can see, this was a partnership between the city of Lone Tree and Douglas County. So Douglas County Public Works helped us through this whole process to apply for this project, is helping fund the local match of this project and will be supporting us. And really, as you can see on the very farthest edge of this map, the C470 trail that goes all the way along the city of Lone Tree and along C470 does wrap around here, and we are working to provide a direct connection between that multi-use trail and the light rail station that today at Park Meadows. This project is something that there's two alternatives today that have been submitted on the design here. There's one in pink and one in blue. Right now, this is just a concept. We are going to be starting conversations with all of the stakeholders and starting to look through what is the right option to look at before we start design. So this is just step one of all of this. But again, CDOT is asking us to at least start an IGA with them so that we can kind of move these projects forward into design in the next several months. And so this is a project that we'll be working with. We've emailed Park Meadows Retail Resort to start that conversation. And obviously, before we do anything, we're going to be working with them on getting their input and thoughts before we move forward with any discussion with the design firm or even putting out an RFP. Next slide. This is just next steps. So next steps for both these projects, staff is currently working with CDOT and Douglas County right now to finalize IGAs for both projects for approval in May or June of 2021. We have several on the agenda tonight. We have a lot of IGAs that the city has been working on, and these are some additional ones that are going to be coming relatively soon. Again, there's preliminary discussions with Park Meadows Retail Resort on the preferred option for this connector will occur before any design work starts. Again, we're hoping to start design for both of these projects late this year or early next year, kind of depending on the timing with CDOT and all the projects as we move forward, with construction of both of these projects beginning in 2022. Again, I know it's a pretty quick overview of some projects, and as we get a little more developed design, we'll be bringing back for more information. But any question on that or on the IGAs that will be coming very soon?
Anything from council?
Good stuff.
Nope. Well, just congratulations to you and the Public Works team, because it's very wonderful that both of these were selected in round one. I think speaks to the quality of the work, and I think these will be important additions to mobility in our community. So we'll look forward to getting them done. So thanks for that.
Yeah, I'd just like to highlight, Dan Rain on our team did a lot of work and a lot of investing into this, worked with all the stakeholders to get letters of support, and we're appreciative of all of the letters of support that came in from all over the city of Lone Tree for these projects. That really meant a lot to our team that knows we have community support, and I think that went a long way at the region to see that. So
that's great. We'll give Dan our regards and say thanks for his good work on that. So thank you.
Thank you very much.
All right, next up, an update on the state public health orders. Bill Medina, our Administrative Services Director. Good luck, Bill.
Yeah.
I might need it.
Yeah,
Mayor,
exactly.
City Council, good evening. So just wanted to provide you a real quick overview and hopefully provide a little bit of clarity on what's going on. So if we go to the next slide, you'll see that the landscape has changed, and that started last Friday when the COVID dial was terminated. As of that time, 51% of the local public health authorities were going to place more restrictive orders than the state order, and 36% of those were going to include some kind of modified dial, which Tri-County went for that option. There are 27 counties that have no local health orders in place, so they're just following the state. That includes Douglas. Some of the other notable counties, Mesa, El Paso, Weld County, don't have any local health orders in place. Kind of as a result of this, the county made the decision to put the business certification program into a dormant status, just because there was no benefit for the businesses, but in the event that we were to need it in the future, let's hope not, but just in case. So if we go to the next slide, I'm going to talk about three of those public health orders: the state limited COVID-19 restrictions order, Tri-County's public health order, and then the state face covering executive order. Next slide, please. So since our neighbors are following the Tri-County order and we're following the state order, I wanted to kind of just provide a little bit of description of both of them and highlight some of the key points. So obviously all of Douglas County, including Lone Tree, is falling under the state public health order. It essentially has no restrictions for most sectors. It does hold back some approvals for and restrictions on mass indoor gatherings, which are classified as 100 or more and are capped at 500. That obviously impacts the Arts Center here, and I've been working closely with Paul and the group to make sure we understand the implications. Social distancing requirements are gone for all but these mass indoor gatherings. They also reserve the right for approvals of outdoor events that are seated and 330,000 square feet or larger, so very large outdoor events, probably only impacting the fairgrounds here in Douglas County. And CDPHE does maintain a snapback provision that if a county is getting near or exceeding 85% of their available hospital capacity, they can direct them to impose some more restrictions. So to contrast with the Tri-County Public Health Order, they essentially adopted a modified dial. It is in effect in Adams and Arapahoe, and they have been moved to level blue as of the 16th, which means level blue capacities and level blue restrictions per the previous state order. They're calling that phase 1. They'll be in there for 30 days, and then in May 16th they'll move to phase 2, which is called level clear, and that is essentially no restrictions. And there is a provision, a snapback provision for them as well, that if they start seeing hospitalization rates increase significantly, then Tri-County will move them from level clear to the appropriate level on the dial. So if there's no questions here, we'll talk a little bit about face coverings.
Any questions on this piece?
No.
No, but this is actually very helpful, Bill, so thank you.
Yeah.
All right, so the state executive order on face coverings expires on May 3rd. It will likely be extended because it's incorporated into the public health order as well. And it applies to individuals 11 years and older. The state identified certain high-risk environments, schools, jails, congregate care facilities, healthcare settings. It does provide the provision for counties that are in level green to modify or lift the restrictions, which is something that's kind of interesting. All the other counties in all other levels, now this was written when the dial was still in effect, but requires space covering in public indoor spaces when you have 10 or more individuals that are unvaccinated or of unknown vaccination status gathered. So that's why we're able to, meet here without masks, given the number of people that have been vaccinated.
Step in just for a second. There's some confusing communication coming from Tri-County about whether their order, they have a separate
face covering order, whether it is in effect here. We're in dialogue with Tri-County. We think it makes sense to be in the same space as the rest of Douglas County for the public health order and the mask order. And frankly, we think that the state executive order is a smart way to encourage more people to get vaccinated, which is one of all of our goals. So happy to answer questions offline about where we stand in that conversation.
That makes sense with regard to your comment on the call this morning.
Yeah.
So thanks.
So if there's no questions here, we'll talk a little bit about some of the metrics that we're seeing. So of course, council is very familiar with the top 3 metrics. We've been looking at these for quite a while now. Really, for the last 3 weeks, we've been pretty consistent, deviating up and down a little bit, but in terms of new cases, positivity, and hospitalizations, we are solidly in yellow, orange per the old dial. A couple new metrics that we added. If you look down there in the bottom, we have a 51% of vaccination rate in Douglas County, which includes everyone 16 years or older that has had at least 1 shot. I included hospital capacity just to give you an idea of where we might stand on the snapback provision. So currently we have 87% of inpatient beds occupied within the county. And the order is pretty vague on how the snapback provision would be implemented if there's a certain time duration. So I can't provide you any details on how the state might look at that.
But Bill, so we're above the 85%? Is that?
Yes, yeah.
So.
One of the other metrics that is also illustrative is that ICU capacity in the county is only at 77%. So that's well within acceptable ranges. Yeah.
That was my question. Is it ICU capacity or is it just?
This is inpatient bed capacity. Yeah.
That you're showing, and it wasn't clear what the order speaks to?
No, the order talks about hospital capacity, not ICU capacity.
Okay, thank you.
But it wasn't clear on if you had to be above 85% for 7 days or 14 days.
Gotcha. Thank you.
There was no detail in that regard. And then the last piece there is related to the Tri-County Health Order. They're using a severity metric when they get into phase 2, and it has a 14-day average hospitalization rate. The county is at 0.63, which is excellent right now. For level clear for the Tri-County Order, it's between 0 and 2. So we're in very good shape when it comes to that. So with that, that's all I had planned. If there's any questions.
Any questions? Other than thank you for unwinding this for us every time it changes, and we'll see you again in 2 weeks. Thanks, Bill. All right, next up is our legislative update. Mr. Hallwell, what is happening down at the Capitol besides snow?
Besides snow. Well, thank you, Mayor and Council, for your time tonight. I will race through these so we can get to the next part of the meeting. But one bit of preface on my comments: the last few weeks, or at least 3 weeks, the Senate and House have been dealing with the state budget. So lots of things that have been waiting in the queue have been for that reason. And then we're going to start seeing some activity in the very next few days, especially because they're hoping to complete by June 1st, which means there's 6 weeks of action on a lot of things and very big things before the summer. So first slide, please. And an example of this is the House Bill 1117. You probably heard a lot about this at CML. This is their initiated legislation to promote affordable housing in Colorado. It allows for local governments to include in their zoning provisions for affordable housing. We're lucky that we have a developer that's including this anyway, but it gives a little bit more local control to affordable housing authority. And it is now going to move. It's scheduled for next week, and they're talking about it a lot in the Senate. It was a House introduced bill, and it sat for a while. But of many things, this is one that's going to move quickly. Next slide, please. And then 2 local government things that are coming that I want to mention. This one again, Metro District legislation is still in the works. Whether it happens in the next 6 weeks, we'll find out by June 1st, but that's a big one that we should be watching. Our partners will care a lot about it. Introduction is still TBD. Next slide, please. And then now you've all probably heard about this, if not yet. There is a pending bill that would mandate collective bargaining for public employees in all sectors, state, local, special districts, and higher education, and one that's starting to get a lot of attention, even though a bill hasn't been seen yet. But stay tuned. I'm sure you'll start hearing about it in your groups when it comes. There was a lot of this discussion, about a decade ago, just from the fire departments and unions that Governor Ritter vetoed at the time. It's a very similar type of thing that I think we'll see relatively soon. Next slide, please. And then switching to public safety, about 3 things to run through. That this one is also going to be, it's been held since it was introduced, but the limits on activity relative to protests that we should be watching, introduced in the Senate back in February. We'll see some action on this next week. Next slide, please. This is the big one we've all been talking about, Senate Bill 62, still waiting to be heard in an appropriations committee. The Senate has been holding a lot of these for a long time. They finally scheduled many appropriations bills today. This was not included. So I think still a lot of behind the scenes debate is happening. But of course, we'll know in the next 6 weeks if something does happen. We'll keep you informed as soon as something moves here and it gets scheduled in the full Senate. Next slide, please. And then House Bill 1250 is, as I mentioned at our last meeting, the follow-up to Senate Bill 217 from last summer. There's additional clarification on what happened in the summer special session that passed to Senate Bill 217, and additional regulation included as well, including some of the 2 of the bullets you can see here about de-escalation techniques and post standards that will receive its very first hearing tomorrow at 1:30. We'll be watching it. CML is currently in an opposed position, but one that I think will start to garner a lot of attention as well, especially as it relates back to Senate Bill 217 and what they want to do. Some of it's cleanup, some of it's new, and we'll keep an eye on it for you. And then finally, in transportation, I have about 4 things to run by you quickly. RTD district operation, also going to be heard next week. Finally, it's clarifying a lot of its organizational rules, but some interesting things. It relieves the district of statutory restrictions relative to its ability to contract with local governments. So we'll be definitely watching something like that for new opportunities, as well as fare box recovery ratios that have limited some of their ability to provide local or regional routes that we want to be paying attention to as well. That's also next week. And Mayor,
I just want to share that the RTD Accountability Committee that I've been serving on, those are the recommendations that came forth from that body. So that the origin of this. So I am very supportive of 1186.
Excellent. Thank you, Mayor. Next slide, please. I have some very relevant news even newer than this slide. This House Bill 1252, the inclusion or exclusion of Parker from the RTD, was heard today by the House Transportation Committee about 2 hours ago. Representative Ransom postponed indefinitely this bill. The mayor of Parker was there, all of their staff. They were obviously supporting it. Director Tisdale and our own director, Julian Bouquet, were there opposing it. They pledged to provide all their efforts to bring Parker or give Parker the service that they're looking for. And through that debate at the very end, Representative Ransom requested to postpone indefinitely. So the new hope is that there will be some additional activity with the town of Parker RTD, and of course it relates to us. One of their big promises was that the 483 was going to be coming back. That's the line from Lincoln Station through Parker and back up to the I-225 station. There are several new service cuts that they had proposed last year that are coming back. So I think we should be watching this. They at least in that committee wanted to propose re-engaging with the town of Parker, and they killed the bill. So
I think we should be engaging with Parker on how we can look at getting service on along Ridgegate Parkway as well over to the end of the line light rail station. So I think there's an opportunity for us. So I would say, as you interact with your fellow council members in Parker, and evidently there's going to be some new ones as of today, right? Their election is today for their those 2 seats. So if anybody hears the results of those elections, let us know. But anyway, I think we should be engaging. I think there's opportunities for us to help both Parker residents and Lone Tree residents and RTD. So let's put our creative hats on around that as well. Thanks, Jeff.
And that's wonderful. Thank you, Mayor. And just as an aside, our own board member, Julian Bouquet, who's new as of this year, spoke on this bill today, and he's very eloquent. I think he's going to be a great partner to us in the years ahead. So finally, 2 more slides, and we know about both of them. The next one is Front Range Rail. Senate Bill 238 was introduced a week and a half ago, and it's going to gather a lot of media attention because it's interesting. It would allow the authority in Colorado to fund Front Range Rail from Pueblo to Colorado Springs. It creates a taxing district, basically, and ultimately this taxing district would have to vote in the revenue to support construction of this entity. Also with big hopes of the federal transportation infrastructure plan and funding for what is likely be an Amtrak system. If you look on the Amtrak map, you can see where they propose lines in the USA, a major line right through the heart of Colorado, and one line right through Lone Tree, if this were to happen, is what is all part of this. But of course, passing this bill doesn't mean we have a rail system. There's a second step of creating a local tax, finding federal infrastructure dollars, and potentially creating other, special districts around it as well. So a long way to go, but pretty interesting that it's moved so quickly, especially in a new administration.
Jeff, I want to just add a little color for council. So there's 3 routes being proposed. One of the 3 would be coming through Lone Tree. And the taxing entity that potentially would be created is something the Metro Mayor's Caucus was trying to do with 1251 last year, and it was empowering existing transportation planning organizations, and was seen as a way to increase revenue for the metro area to fund our transportation system without Front Range Rail. So I'm not for or against 238. I'm still learning about it, but it does potentially limit the ability of the region to come together to fund existing transportation needs that we already have, the unfunded needs that exist in the metro region. So again, that's just a data point, not a statement of support or opposition. Thanks for letting me say that.
Oh, of course, Mayor.
And sorry, Jeff,
Yeah.
just for clarification, you said this district would only pertain to Pueblo to Colorado Springs?
No.
It's a very large region. The southern border would be the Pueblo area, Pueblo County, and even actually, forgive me, into Huerfanel County where Walsenburg exists.
Okay.
But then north to Cheyenne. And what the district includes for Metro Denver is any entity within an MPO, meaning the Dr. Cog map.
Got it.
For other areas that aren't in an MPO, it'd be basically 2 miles east or west of I-25. So it would encompass regions that don't touch a planning district. But for Metro Denver, it includes any region in Dr. Cog, which is all of Lone Tree.
And there's also an opportunity, I should have said this as well, for this to fulfill some of the obligation for RTD and the North lines, so that they could collaborate with each other to solve some of those problems as well. So there's a lot of good things this potentially could do. It's very, very expensive, and I think is really heavily reliant on federal funding. So thanks.
And then finally, last slide, and I don't have much new information. I'll turn it over to you, Mayor, but the transportation funding legislation, that led introduction is still TBD. And if you want to share anything, please.
The bill, the potential bill continues to be negotiated, and they keep saying it's going to be released soon. It's my understanding. We are in the final throes of the negotiations, and I think they're waiting till I go on vacation. So I would expect we see something very shortly. But everybody's been working hard on it. Dr. Cog's been working hard on it, Metro mayors, county commissioners, the environmental community, and a lot of very good productive dialogue. We'll see where it ends up. Thanks, Jeff.
Wonderful, thank you.
Thank you. All right, quick. Yes, Wynn.
One comment, and I wondered if you had heard it as well, that if the legislature kind of adjourns or recesses, let's say around Memorial Day, that they could come back for 10 or 12 days in September, October timeframe to work with any new COVID funding or infrastructure that the feds pass later in the year?
Yes, Councilmember Shaw, there is talk about, especially with the stimulus funding that's still trickling into the state, there's conversation about dealing with a lot of that in a separate legislative session that the governor would call after they conclude. So and the talk would potentially be September, but limited to how they budget for incoming stimulus dollars.
Thanks.
Yeah, thank you.
Okay, thank you, Jeff.
Thank you.
All right, next is consent agenda review, and we have got minutes from April 6th, claims from March 30th through April 12th, and our February 2021 treasurer's report. Are there any questions on consent? No. Okay, well, we will entertain that during our council meeting. We do have exec session tonight. So Seth, can you just in 2 sentences just give everybody a super brief update on Park Meadows Metro District and the and the brick fence, because we did get a question about that last night, just to make sure council knows what's going on, and then we're going to go into exec.
Sure. So we had a good meeting with Park Meadows Metro District and their consultant, their brick fence consultant, and that assessment is getting ready to kick off. There will be letters, certified letters, going out tomorrow to more than 300 property owners within the city, notifying them that this assessment is starting, and that they'll be getting further notice via a door hanging tag of when that assessment will be happening, because it doesn't require anybody to enter the backyard, but it does require the consultant to put kind of an arm with a camera over the fence to quickly kind of take a look at the interior of the fence. We and the consultant have a project website. The consultant's project website is really complete, and ours will refer to that for more detailed information. And then we're developing a common email tracking system so that any email that comes to the city will be shared with the consultant and with Park Meadows Metro District, so everybody has the same visibility about what communication is coming in and what communication is going out. So that's it in a nutshell.
Thanks, Seth.
Yeah.
More will come on that, but since the letters are going out, I want to make sure everybody's aware when you get a call from a constituent, what the heck is this? This is what the heck it is.
This is what it is.
All right, so we, as I said, we do have a executive session this evening, so I am going to open our regular meeting. I want to announce that all council members are present and we do have a quorum. I will ask our city attorney to state the reason that council wishes to convene an executive session.
Mayor and City Council, the purpose of the executive session is pursuant to 24-6-4024B and Article 4, Section 6 of your Home Rule Charter for matters of attorney-client privilege regarding the Skyridge Avenue Bridge claim for damages.
So moved.
Second.
All those in favor?
Aye.
Okay. We are 5-0 and vote to go into executive session, and we will reconvene for our regular meeting at 7 o'clock. Okay. All right, everybody out.